Okay, so by now you've probably heard about our lofty goal, which is to reduce the infant mortality or the number of deaths, the percentage of deaths of kids with sickle cell disease from 75% by the age of 5 to less than 10% by that same age by the year 2025. I know that's really lofty, and there's no way, no way at all we'll be able to do it on our own. But we got to start somewhere, and therefore I'm just going to lay out our plan. And this can only work if people like you partner with us and support us in any way you can. And I'll be showing you how. So we usually use a 4-part strategy, which is the CARE, what we call the CARE initiative. It's an acronym. C stands for charity, A stands for advocacy, R research, E education. All right, let's start with the first one. Charity. We, as you know, have been doing a lot of charity work in Nigeria, Abuja, Lagos, and then of course around the country. People can call in and they can get their supplements shipped to them. They just pay for shipping, and we give them stuff to help them, supplements for everything from vitamin C, vitamin D, zinc, magnesium, and some of the more expensive ones, depending on their situation. So that has been going on for about 7 years. Now we're going to take a big quantum leap. We've partnered with Impact Kids and Tackle Sickle Cell Foundation, both based in the US. Tackle Sickle Cell is owned by 2 NFL players, superstar NFL players. So we're really super stoked to partner with them. And we are going to address or support 2,000 kids every month for the next 1 year. So that's a huge investment. So one way you can help out is if you have a foundation or you know someone who has a foundation that supports sickle cell disease, especially in the remote areas, children with sickle cell disease, especially in the remote areas. You can hook us up so we can partner with them and we'll supply them with the supplements and, of course, on a monthly basis. That's one way we can do it. Obviously, help support us in our clinic. We have free Friday clinics in our center in Abuja. We also work with the Wuse General Hospital. So each week too, we're there supporting them in their clinics as well. Now we're looking to expand to other places, Lagos as well. Information is on our website. Number 2, advocacy. Advocacy, we're going to get back to it in a little while because that's so important. But advocacy really means working with the government, working with decision makers, working with people who wield influence, big multinationals, and saying, hey, listen, let's partner, let's help these less fortunate kids, especially those in remote areas. They're the decision makers. That's why we have our MOU, Memorandum of Understanding, with the Ministry of Health to allow us to do what we're doing. Again, I'll get back to this in a minute. So research, everything that we're doing, whether it comes to helping kids with sickle cell disease, we're giving them in the clinics, we're giving them free supplements, we're shipping them into them around the country. All that really is just a drop in the bucket. I mean, it's not really make much of a dent. In fact, to call it a drop in the bucket it's really an insult to buckets and drops everywhere. When we're really going to start making a difference is when healthcare professionals, pediatricians, nurses, physiotherapists, surgeons, hematologists, caregivers, teachers, parents, and so on and so forth, grab or take a hold of this principle of strengthening the immune system, because that is really where it has to start. And again, it's so simple. We talked about vitamin C, vitamin D, zinc, and the other really nice immune support supplements. If we give enough of those things, these kids do so well. And so, but unless we have the data that shows that this is a fact, it doesn't matter how much we talk about it, doesn't matter how many testimonials we show, it's not going to move the needle, so to speak, where the doctor is concerned. And since most patients are going to go see doctors anyway, it does make sense that we provide the data so that doctors can feel comfortable about prescribing these other supplements that we talk about so much. So research is so important. In the next 1 year, we've been given approval. Now, what we're doing is we're trying to raise money to do the research in hospitals. We've been given approval in Lagos State General Hospital, General Hospitals. So thank you, Healthcare Commissioner of Lagos State. So appreciate it. So there are 3 hospitals we're working with. We're budgeting for about 300 patients over the period of about 6 months. So we're just getting things in place. And University of Ibadan too, we're working with the research association, research committee too there. We're going to do another set of research there. Abuja too, we've got permission to do that. And of course, we've gotten the federal government permission to do research in general. What we do need is Ekiti State, because I'm from Ekiti State. So if you know anybody who is, if you know the healthcare commissioner in Ekiti State, hook us up. Also, if you know the governor of Ekiti State, hook us up as well. So we would appreciate it. Finally, E, education. And that's really what I'm doing right now. And that's what we're doing on the social media platform. A big thank you to our staff and volunteers for the wonderful work that they're doing to make all these testimonials and all these teachings available on social media. So there are tons of them on the social media platforms. You can check them out. So there you have it. Care, charity, advocacy, research, education. Let me go back to advocacy because I said I would. Advocacy is so, so important. Unless the big boys, the powers that be, the organs at the top, unless they really grab a hold of this thing, we won't even be able to move the needle as such. So if you have people in high places in government, in the military or wherever, let's connect, let's work together. Simply connecting us with the right people can help us take such great leaps or great strides forward that we on our own would not be able to do. So that's our plan of attack. They see it there. Hopefully you would reach out to us. BrainandBodyFoundation.org is the website. Same thing on our platforms as well. The WhatsApp number is there for you as well. So we would really love to work with you and partner with you in helping these kids. Remember, our goal is to reduce from 75% to less than 10% the number of deaths to sickle cell disease that happen before the 5th birthday of these kids. And yes, it's lofty, but together we can. Thank you.